guest, Dr. Zaheer Shah, who is a primary care physician in Tempe, Arizona. Dr. Shah, your perspective and guidance has been incredibly valuable to our understanding of how to stay safe during these unprecedented times. I want to start by asking you what we've learned about the virus itself since the first case was detected here in the U.S.
Well, as you said in the opening of your broadcast, it's a somber day, a day when over 1 million people worldwide have succumbed to this virus, where in my own home country, the United States, over 200,000 people have died. Early on, it was a challenge to identify even how this particular virus presents in a human being, and more importantly, how can we treat it? How can we keep people out of ICUs, off of the ventilator? And now, here in the fall of 2020, as I look back at what have we learned about this virus, I have a couple of things that I can point out. Number one, that steroids work, particularly dexamethasone. We know that that works in particularly sick individuals and is now being used as a standard of care in the ICU setting. We know that hydroxychloroquine, despite the fact that it was pushed pretty strongly by certain members of our political elite, does not work. The CDC has laid that to rest. We know that vitamin D can both prevent COVID-19 as well as to help treat it. And I think the most important lesson that we've learned, not just here in the United States, but worldwide, is that the best way to prevent the transmission of this deadly virus is through social distancing and the use of simple masks. I can't emphasize that enough, that this is not about spreading through contact, physical contact. In the beginning, we were using all kinds of agents to sterilize our hands and sterilize our environments. And even though while that may still be somewhat important, the real take home that I've learned is that as long as we can control our respiratory droplets and keep them from communicating from one human to another, and the most logical way to do that is by usage of masks and social distancing, that we can effectively prevent the spread of this deadly virus.
Dr. Shah, the pandemic has become a matter of politics, particularly here in America, and the coronavirus is expected to feature heavily in Tuesday's presidential debate. We know President Trump will be forced to defend his handling of the outbreak here. From a medical perspective, what are the challenges there?
Well, speaking merely as a medical doctor and not trying to politicize what should have all along been a public health crisis and a public health challenge, I can tell you that our current president has virtually gotten it wrong at every turn. I think initially he was overly aggressive in trying to minimize the severity or the significance of this disease. I remember at one time he was telling us that there was just a few people that have the infection and soon there will be none, and that somehow the virus will just go away on its own. Well, here we are in September, and the virus is here to stay. We're still dealing with it. Over 1 million dead worldwide, over 200,000 dead in the United States. So that was wrong. The president also emphasized, and by his own personal example, minimized the importance of social distancing and the usage of face masks. He held rallies in which large groups of people gathered together and potentially could have did spread the virus. These kinds of examples and positions that our president assumed, I don't think did anything to benefit the challenge that we were facing as physicians and as a community dealing with a deadly global pandemic. Now, whether I agree with Joseph Biden on a lot of other issues or not, I have to say that his stance from the very beginning has been about social distancing and about the usage of masks as an effective strategy to limit the spread of this virus. And so I think that in terms of this particular issue, and clearly it's a huge issue, it's an important issue, I think that you're going to be seeing a good comparison and contrast, and really a stark contrast between the current president and the Democratic challenger, in that they have very different approaches to how to try to prevent this deadly virus. And I think if the body of science were to weigh in, if physicians as a community were to weigh in, we're going to have to side with Joe Biden on this one.
Self-isolation has been an important but controversial aspect of this pandemic. What have been the pros and cons there?
Well, it's unprecedented. We live in a digital age. We live in an age where we are so accustomed to being connected to one another. And now, because of exigent circumstances, we've been forced to isolate, to move away from one another. And as a practicing physician who sees patients in his office throughout this pandemic, I can tell you that I've seen two extremes. I've seen people who have found deeper truths and found better ways to understand themselves and their world as a result of this opportunity to reflect and to take maybe a more thoughtful, a deeper look at the world that we're in and, how can we improve it? And so there were moments in which I felt as if, as a result of the world sort of shutting down, of us all doing a reset, that it was an opportunity for us to be more reflective, more introspective, and as a consequence, maybe come up with solutions that we as a civilization or as a world had been too busy to come up with previously. That's the upside. And I do believe that there's plenty of that to be gained from what the consequences of isolation have done in this pandemic. But the downside is that this isolation, coupled with the fact that our social media tends to fragment us into individual groups, I think that has created a perfect storm of isolation and of alienation. And I see a lot of mental disease in my practice now that I wasn't seeing before. And interestingly, I also see a lot of the stigmata of people who, as a result of their isolation and containment in their home, they're gaining weight. If they're diabetics, their hemoglobin A1Cs are increasing. Their lipid profiles may be worsening. Their blood pressure may be increasing. So I think that it's like, in many ways, a problem that we just have touched the surface of. I think there are going to be significant consequences, both good and bad, from this forced social isolation that COVID-19 has induced worldwide.
Dr. Zaheer Shah, I don't think there's anything that you said this evening that our international audience can't identify with. We really appreciate you coming on to add your analysis and expertise. Thanks for that.